PPK Farmer tutorial. In this video, we are going to discuss about chemical mediator which influence the or which causes the inflammation. This topic comes under B Pharm C, first year, second semester, pathophysiology, unit 1. Before going to this video, if you like this video, please click on like button and subscribe our channel PPK Farmer Tutorial and click on bell icon through which our videos will be updated to you. Now we will go into the topic. First, what are the chemical mediators? First we need to know the definition of chemical mediators. Chemical mediators are the substances which act as a mediator of inflammation, which can be pre-released from the cells, the plasma or damaged tissue. It is the mediators of inflammation which is pre-released from cells and damaged tissue. This is the definition of chemical mediators. Next, mediators can be derived from various sources and their role in acute inflammation are: first, cell-derived mediators. Here the different sources are cell-derived mediators, plasma proteins, arachidonic acid metabolism and lysosomal compounds. Here cell-derived mediators example vasoactive amines. Their role is vasoactive amine. Example histamine, 5-HT and neuropeptide. And in lysosomal compound, nucleophilic products and monomacro products. First we will see vasoactive amines. Under that histamines. Histamines are stored in mast cells, basophils and also in platelets. The histamines are released from various agents such as stimuli substances which induced acute inflammation. Example cold, heat and radiator. Histamine releasing factors from neutrophil, monophil and platelets are interleukins. Okay, histamines are stored in various cells like mast cells, basophils and platelets. These are released from various agents which stimulus it released when heat, cold and radiator occurs. Since histamines are released, it shows some particular action on human body, that is action of histamines, which is vasodilation, pain, itching, increased permeability and also stimulation of mast cells and basophils. This is the function of histamines. Next, 5-HT. 5-HT is present in the tissues like chromatin cells of gastrointestinal tract, spleen, nervous tissue, mast plates and platelets. What is the action of 5-HT? It is similar to that of histamines, but it has less potent mediator of increased permeability and vasodilation than histamines. That means we can say 5-HT is somewhat less potent when compared to histamines in order increased permeability and vasodilation processes. Next, neuropeptides. Neuropeptides are the small peptides produced in central and peripheral nervous system. What is the action of neuropeptides? It increases the vascular permeability, transmission of pain and stimuli and also mast cell degradation. Mast cell degradation means degranulation of neutrophil, basophil and eosinophil. This is the definition and action of neuropeptides. Next, plasma proteins. It includes three interrelated systems, that is kinase system, complement system and coagulation system. In kinase system we can see bradykinin and kallikinin, and complement system here we have C3A, C5A, C5B and CA mediators, and also in coagulation system fibrinolytic system. Bradykinin, C3A, C5A, these are all the mediators of increased vascular permeability, and also C5A act as an chemotoxins. Next, amino acid metabolites, that is cytooxygenase and lipooxygenase. Cytooxygenase example is endoperoxidase, prostaglandins, thromboxane, and lipooxygenase example leukotrienes. HPTE, hydroperoxy elicosa tetraenoic acid. HETG, hydroxy echoes of tetronic acid. Okay, next, amino acid plays a major role in homeostasis, coagulation, inflammation, and thrombosis, and also cardiovascular, endocrine, renal, and pulmonary functions. These are the roles places where amino acid plays a major role, vital role, important. Amino acid is very important in these places. Next, the final one is mediators, lysosomal components. First, we need to know the what is lysosomal component. The inflammation cells like neutrophils, monocytes contain lysosomal granules which release variety of mediators of inflammation. Means these monocytes and neutrophils contain lysosomal granules. They release mediators of inflammation. Next, neutrophilic products is divided into three categories, that is cationic proteins, neutral proteins, and acidic proteases. First, cationic proteins. It increases the vascular permeability and chemotoxins of monocytes. And neutral proteins, example collagenase, elastase, which perform the tissue destruction. And acid proteases degrade the bacteria and debris within the phagolysosome. Next, monocytes and macrophages, which which these plays an important role in chronic inflammatory reactions. Examples of monocytes and macrophage products are acid hydrotase, collagenase, elastic plasminogen activator. This is the different types of chemical mediators of inflammation. If you have any doubt, please comment on comment section. I will clarify your doubts, and subscribe our channel and share this video to your friends. It contains valuable information. This will be helpful for your exam to gain better marks. Thank you to all for watching this video. Bharat Mata ki Jai.